system data, it was explained to us that these are data generated by the digital health tools themselves. And they include the transaction logs, the users' activity systems, as well as the reports that were generated by the digital health platforms. And then wait for that to say that we have surveys, so that's like questionnaires for the stakeholders to ask about their satisfactions, their knowledge, and their practice. And we also talked about qualitative methods, that's collecting qualitative data from Ministry of Health officers, and also, conducting focus groups with them, asking health workers questions about the utilizations of the digital health platforms and the responses they've been getting from end users. And we also talked about document reviews, that's project reports, minutes meetings, and whatnot. And we also, I think we went into discussing the plan. They said, I think, yeah, we thought that we shouldn't start with a plan. We're meant to start. There are some things we look into. We shouldn't start with the tool rather, but we should start with a plan. Sorry. And for the planning, we have to look into defining key evaluation questions, developing a result framework or the logic model, identifying indicators that are links to intervention goals, as well as designing a data collection plan. And when we want to design a data collection plan, there's some certain things we have to look into. We have to ask questions like, what is the data? Who is going to collect the data? How often are we going to be collecting these data? And in what formats do we want these data to be coming in? So from there, I went into things we have to look into to ensure that the data has quality, and then they are reliable. We looked into the validity, reliability, timelessness of the data, the completeness of the data, as well as the integrity of the data. So I think this is a summary of all what we looked into in the morning. Yeah.
No, thank you for that clear explanation. This is really appreciated, Mr. Nelson, and good job. Anybody else who want to add?
Yeah, thank you. Thank you.
Yeah, I think in the chat box, Ashanafi has said we learned on how we can ensure data quality and reliability. Yes. Anybody else? Yes, Khalifa, you can go ahead.
Okay, thank you. I don't want to repeat what my brother already mentioned, just to add 2 or 3 points that he left. Additionally, we have seen data quality checks, how we can check the quality of data. We have seen 2 methods for system designing for digitally generated data and MND protocols, developing NDME protocols for manually collected data. Next, we have seen strategy for data quality check. The first one is clear indicator definition is one method to ensure data quality. The other one is training for data collectors. You have to train data collectors clearly. Thirdly, the other one is feedback loops, giving feedbacks on the data quality, reviewing routinely on the data quality. And the quality audit is also another strategies for data quality. Finally, we have seen the ethical consideration and privacy regulation in digital health, how we can manage privacy and data ethical regulation in digital health. We have to we have seen that digital doesn't mean it is ethical free. We have to consider ethical consideration in digital health by informed consent, risk re-identification, regulatory frameworks, and the role of data governance can help us to manage ethical condition and the privacy regulations. Thank you.
Yeah, thank you, Khalifa. And now, before we begin, we will start with a very short quiz to warm us up and get everyone thinking about today's or the morning session. So please take a moment to respond. This is just for engagement, so feel free to participate. And the quiz will come. Wait a few minutes.
So can we give us the code, please?
What did you say?
No, to access the quiz, the code to access the
Yes,
quiz.
yes. It's popping on the window. You can scan the QR code and you will have the questions there.
So the first question is up. Please kindly take it before time. You have just 16 seconds.
The questions are yet to load. Okay, just load it.
Okay, so can you
Yes.
join on the, are you able to join?
Yeah, I'm on, yeah,
Are
I'm on
you,
Slido.
okay, so,
They are not active pools at the moment.
but the question is not loading for you.
I think it will load now because I just saw get ready. 29 participants have already joined. Okay.
So can you see the question now?
Yes, I can.
All right. So we have 20 seconds left. So there are some tools that were shared during the morning session. So let's see who is able to get this. All right, time up. Okay. So the answer is ComKit, and we have Belit leading on that. I hope everybody is following. So move to the next question now. In ensuring quality, trustworthy data, what key factor has to do with ensuring the indicator measures what it tends to measure? So these are some of the qualities of data that was discussed in the morning. Time up. So let's see, the answer is validity. Let's see, no, reliability. So we have Autobunk leading now. Next question. So we have, this is the second to the last question. So you have 15 seconds left. All right, time up. So let's check what the answer here is, which is of the data sources discussed, which data source is primarily qualitative and designed for smaller targets. So the answer is key informant interviews. I think majority actually got that. So let's see the leaderboard. Wow. Mohammed is on top. Okay, so to our last question now. In ensuring data quality and reliability, what strategy was discussed? So which of all of these options were discussed in the morning if you are paying close attention to the facilitator's presentation? So fastest fingers. All right, time up. So let's see the answer. Okay, both of these strategies were discussed. So Godwin, congratulations for winning this round. All right, thank you so much. We'll go back to the presentation. Thank you.
Okay, can you
Thank
check number 2? Question number 2.
Sorry, let's go into the session so we can take questions after.
No, I
So,
answer for the
Asmika
number
is
2.
here
Question
already.
number 2.
Sorry, can we attend to you in the chat so that we can continue with the session? Thank you. Faith, can you hear me? If you can hear me, you can kick off your presentation. All right, so I guess okay, our speaker is just joining, so please let's give her a few seconds to join the meeting. So back to the question you were asking. Sorry, can you take that again? Answer for question number 2. That's reliability, I guess, if I remember what the question is specifically. Is that what you're asking for? I don't know who was asking that question, but so let me know if that answers your question. So, Pelumi, please can you confirm if Faith is now with us in the room?
Sorry, she just dropped again. She's struggling with her network.
All right, so please, we crave your indulgence. Give us a few seconds to allow our facilitator to get back into the room so that she can take our presentation. All right, if you're just joining us, we are just waiting for a few seconds to allow our presenter to join the room. She's having a bit of network delays, so kindly give us a few seconds to ensure she's able to log in into the room. But while we are waiting for her, just to reiterate the announcement, the slides will be shared in your email by the end of today, as we shared yesterday's slides with you. So please check your email for a link to the Google folder with the slides. Also, your case study, please prepare to submit at the end of tomorrow's session, which is the last session, and that's tomorrow evening. So the link for you to submit the case study will be shared so that you can submit the case study. And please note that the case study submission deadline is on Wednesday next week. So please, as much as you can, try to submit because it qualifies you for the certificate for this 3 days workshop. Slide for session 2 will be uploaded this evening. So as we've said, don't worry, all the slides will be complete. Even if they're not there yet, you will get everything before the end of the entire workshop. If you want to rewatch, you can go to our YouTube channel and you'll be able to rewatch all the sessions in case you missed any of it. Hi, Andrew. Welcome. Will you be having the presentation now?
So, hi, Vivian, good evening, and good evening, participants. Sorry, I was hijacked. Let me see where to get the slides and give me like 5 minutes.
So I think we have the slide on our end, if I'm correct. Do you want us to share for you, or you'll be able to present on your end?
Okay, you can present, it's okay.
All right, just let me share my. Okay, so let me know if you can see my screen. Can you see my screen?
Yes, yes.
Okay, so let me take it to slideshow. Yeah, so I guess. So you can let me know when you want me to move this.
All right, thank you. Good evening, participants, and welcome for the third cohort, the M&E Digital Health Workshop. I'll be stepping in for Faith since she has some challenges with the connectivity. So my name is Andrew, and I'm the founder and the director for Malhab Africa. I shall get to introduce myself a little bit better tomorrow. So next slide. So in today's session, we shall be discussing more about how we can go about with the analysis for some of the digital health programs or projects. But I'm really hoping that it has been a marvelous and fantastic session from day one, because we are just building on from what previous facilitators has been presenting or discussing about. So when we talk about analyzing digital health data, what should come into our mind is that we want to portray or present information or see how to turn the raw facts into meaningful information. So that is where the analysis comes in. We are trying to manipulate the data so that we can make some useful sense or information out of the data. So we need to appreciate that it's very important that even before you reach the analysis, you must appreciate that the data itself must be of quality. And if the data is to be of quality, that implies we look at several dimensions, such as, is the data accurate? Is the data complete? Is the data reliable? Okay. Is the data timely? Okay. Those are a few dimensions that perhaps we could think through to ask ourselves. So it's very, very important that we make sure that the data that we are going to analyze is really of quality. And the types of data may also varies. I believe we are working on different kinds of programs, different kind of projects. So that means we are analyzing different types of data sets. So you have the data from, let's say, the electronic medical records. You have the data coming through from the DHIS2. Perhaps those are quantitative, but you might also want to think through how could you analyze some bit of qualitative data. So those are just some types of data set that perhaps we could manipulate and see how best to present the information to the different stakeholders. I will not dig so deep into analysis techniques for now, but I think it's in the next slide. So you need to know what kind of data set are you dealing with. If it's a quantitative, then you need to think through of some quantitative approaches. If it is a qualitative data set, then you need to think through how to go about with the qualitative approaches. And then, of course, taking in mind issues to do with data privacy and security, which is very important. Making sure that the data is kept at the utmost safety or safe custody, I would say. Issues to do with confidentiality, because imagine you're a biostatistician and you're working in a health facility. You're handling a lot of data from the patients that has a lot of sensitive issues that you would not want it to leak out or to another third party in one way or the other. So data privacy and data security are very important. And I think different countries in Africa have different policies regarding how they can protect or secure data. Next slide. So in M&E, there are various techniques that we can go about. I will start with the quantitative. So when we talk about quantitative data, we're actually looking at how can we play with numbers so that we can make some sense from this data. And when playing with numbers, these are the three different kind of categories of analysis that we can think about. We have the descriptive analysis, and under descriptive here, you just want to summarize your data set to understand more about it. You want to explore issues to do with the mean. You want to check on the variance. You want to check on standard deviation. You want to check on the quartile or the interquartile range. You know, that is descriptive, and this is the first or the simplest, I would say. Whether someone is a statistician or not, this is the simplest and the first thing. Then we also have the predictive analysis. People who perhaps might be familiar with predictive analytics. Should be able to understand better when you want to explore some bit of models, especially in machine learning. So this is also another bit of analysis that you can employ when it comes to making use of data for different health interventions or programs. Then we have the prescriptive analytics. So for prescriptive, especially for it goes beyond just giving a prediction, because at prediction levels, we just want to explore and see what is going to look like in the next future. So you're predicting either performance of either your app, your application, whether there will be high adoption, whether there will be high, if it's a preventive app, whether, so you're looking at, you're forecasting to see what is most likely to happen, in the future. Will there be higher uptake? If let's say you've designed a app that works in, let's say, sensitizing adolescent girls on issues to do with family planning or sexual and reproductive health in general. Okay, so but prescriptive, it goes beyond just giving that that prediction. So for it suggests that action based on this, on what we are seeing from this predictive analysis, it will now help inform policy. It will now help us adjust on program management. It will now help us allocate resources effectively. So it's usually very, very nice when someone goes beyond and do a prescriptive analysis rather than just stopping at predictive. So all this can be used with different tools. You can do descriptive analysis using Excel. You can do it using Stata. You can do it in R. You can use Python, as well as predictive and prescriptive. Another analysis technique that you can also think about is comparative analysis, or where we bring in inferential analysis. Those are techniques that deal with logistics, regression, and you perhaps also have to do some bit of modeling. Then in addition to this, we have the qualitative analysis, which is also another technique for analysis. So you could also want to attach meaning. You want to, after exploring the pattern, you've seen what is coming out from your predictive analysis, from your descriptive analysis. You've done some t-tests, you've done some ANOVAs, you've done some regression models. So you want to understand, you want to ascertain, put some meaning. What could be the logic, okay? Or what could be the factors that is pulling what we are seeing from this analysis. So you will now go through and of course do, most of them are grounded theory analysis, thematic analysis from your qualitative data set. So that is briefly about analysis techniques for M&E. So just like any other research methodology, we also apply them in M&E, whether it is a mixed methods, whether it is a purely a quantitative or just a qualitative. Next slide. So from the point of doing analysis, you've done your analysis, so perhaps you want to put some visuals, you want to design some dashboards to your stakeholders so that they can easily see or understand what you're talking about. So it's very important that we also think about or how to develop some dashboards or how to put visuals to your data when you're presenting your findings to the stakeholders. So first, I would want to say that the dashboard is very, very important. And for any kind of a beginner, someone stepping into the data science world, I think it's very important to have hands-on when it comes to developing dashboards. So a well-developed dashboard can easily present complex information to different stakeholders, to different categories. Is it the community members? Is it the policymakers? Is it the decision makers? Is it management at the workplace? So it's something that really speaks or simplifies information, okay, at whatever level. And creating charts that are very much appealing. I remember when I started, it was very challenging because I used to struggle with colors. I would not really put the visuals in a very lovely way. I would see my visuals are not attracting. So you also need to know how to play around with colors. You need to know, see how to design something that is really attractive. So even before you publish your visualization, you need to first ask yourself if you're liking the charts you're seeing. Okay, are you liking the charts you're seeing, or you're not liking it? Vivian, the slides have gone off. So creating dashboard is very important. And as you create, you need to think through what charts are you going to use? Is it a pie chart? Is it a column chart, a column graph? Is it a line graph? Is it a heat map that you're going to use? So different kind of information is presented using different kind of charts, okay? And you really need to have them customized. So you customize them. And for the M&E officers who perhaps might be in the call, if you design your M&E system very perfectly, you don't need to be chasing after your project officers, your field staff, because it enables real-time information. Whether you're sitting in the UK, whether you're sitting in Iraq, you're able to get real-time information. This data comes in real time. You're able to download your report in real time, okay? So this can be done using several tools. We have the Power BI, we have the Tableau, we have the Kobo, we have the Data Looker Studio. So these are good powerful tools that you can use to visualize or create a dashboard, be it a static dashboard or a live dashboard. I remember there was a time when we developed some M&E system, and the data would come from Savesitio and sits on the Data Looker Studio. It was very magical. All the field officers, everyone liked what they were seeing, because in terms of accessibility, they would assess. They had no stress of monthly report because all the data goes to the server in real time. They could see the progress in real time. They would be able to track participants in real time. So I would say dashboard and data visualization is not about the color, but it's about presenting that complex information in a very simplified term that anyone can also understand. So I remember I used to ask myself, if a child or someone who has not learn on this dashboard, can they really pick some information? So you should be having a aim of passing out the information rather than focusing on the coloring, okay? So think through how to present those information in a very simplified manner, whether you want the maps, whether you want the charts, and so on and so forth. Next slide. So at the end of the day, when we really put meaning to our data, it must be having an aim, and the goal is that decision makers, policy makers, practitioners should be able, to make an evidence point of view from the data. So sometimes you might be working on your data set, you produce a lot of dashboards and stuff, but if the uptake is not there, then it's like waste of resource. So the ultimate goal is that there must be an evidence point of view in terms of making an informed decision, which is data-driven. So all that we do, the end game is to support decision makers, to support policy makers, to support practitioners, to support management in making an informed decision, be it in terms of resource mobilization, be it in terms of engagement strategies. It must be backed up with some evidence. And these days, honestly, if you're working on an idea and it's not backed by evidence, I think it's at a very, very disadvantaged, kind of, I would say, very unfortunate, because the world is now moving. The donors also want evidence. They want to inject their funding where they're seeing value. Okay, so if you're thinking of developing an application, there must be a very scientific justification that is data-driven. How many people are affected? You want to solve the problem. How many people are affected? How many, whether it is maternal death, how many children die per day, per month in the region, in a year? Okay, so that is the kind of data-driven decision that we should be aiming at. So let me talk about integrating insights. You combine, for instance, you combine the insight, be it from qualitative, be it from the quant analysis that you've done, so that it can enhance program effectiveness. So now you're using the information, you're using what you gathered, the analysis that you've done, to enhance or to better understand program effectiveness. What is the likelihood that this program will survive? What is the likelihood, or to what extent is this program going to be scalable? So you need to think of the cost of developing an application, how many users and so on, but scalability, adaptability, all that must be formed by data. You must have done, even if not a feasibility study, but at least done some peer, some desk research to gather some information that what has been done elsewhere, how was it done, what was the outcome, okay? The next important one is feedback mechanism, which it's almost at 90% ignored. So gathering feedback is very important, and that is where the aspect of accountability also comes in. Engaging the different users, participants, right from stage 1 to the final stage of your intervention. You get to listen from them, what they have liked most, what they feel should be improved. For instance, if your intervention is system, it's on system thinking, or it's a system intervention. And we know that system usually needs a lot of continuous improvement. So we need to ascertain from their point of view, what do they really feel should be improved over time? What do they really feel is lacking? What can we really do different? Okay, so getting feedback from the end users is very important. And I think that's why so many programs go back midway to assess what are some of the challenges, how could they also go about solving them, and so on and so forth. Because the world these days is a changing world. Tomorrow you wake up, there's a new thing, different from the next day, and so on and so forth. And then, of course, stakeholder engagement. When it comes to stakeholder engagement, most programs usually engage their stakeholders at some specific intervals. But I would want to say that it's better to engage stakeholders continuously. And when we look at the participatory pillar for M&E, it emphasizes that stakeholder engagement should be throughout the intervention or the program. When you're developing, reach out to the stakeholders, inform them, involve them, engage them, consult them. Midway, engage them the same until, because this really enhances ownership. Even when you don't have donor funding along the way, you'll find that your program is, your program is it's kind of a continuous process. It's still existing, even when the donor funding has really engaged, has ended. So stakeholder engagement is very, very important when it comes to making data-driven decision. Now, assuming it's something you're doing and it's related to policy, you really need to know how to play around with the politics on how to engage the national stakeholders, both at government levels, local levels, because the policy affects the grassroots members. So you also need to think about how will you engage the community or the final beneficiaries at the community level. Okay. Next slide. So in terms of conclusion on effective data use, it's very paramount that for all our digital health interventions or programs or projects, data plays a lot of role. It plays a lot of role in enhancing digital health interventions. How, in the first place, it has impact on uptake or effective use of data. In most cases, I've actually learned that so many countries have a lot of data and they don't even know how to utilize the data or how to make meaning of the data. To some point, they make meaning of the data and it ends there. So they don't know what next for them from this data. I remember last year after some conference, so a member from Red Cross came and was like, we have a lot of data set which is seated. We even don't know, sometimes they call and, they need an ambulance. They say someone has got an accident there. We need to rush the ambulance there. Before this, another call has come in. So they were like, can you really help us on how to align our data set? Use this data set so that at least we can be able to effectively implement our interventions. So we have to do some bit of predictive analysis to see the hotspots, during which kind of periods, so that they set their standby, a standby team, a rescue team, and so on and so forth. So you see that kind of dilemma. So leveraging on digital health really is something I would say is very paramount, because you need to continuously monitor the hotspots. If it's something related to death, maternal death, you need to really continue to monitor what period, under what circumstances. So that is how the M&E aspect comes in play, because for us as M&E, we then set some bit of indicators to see, okay, if there were about 50 deaths in the period of May to August, or in the period of between November to January, there could be some other factors that are associated to this. So we want to also explore and find out what is behind this pattern. Is it kind of December is related to travel, people are moving up countries, and so on and so forth, okay? And that drives us to the future consideration. When you really make the best use of the M&E data, there will be continuous improvement. And these days, we always argue that, there's no way the world can do without innovation. So there's continuous innovation. We need to think, if you're thinking of developing some system, developing some application, you need to think about that there is innovation tomorrow. What you're already doing right now, actually tomorrow you can wake up and you already find it's already out as a product. So you need to think of how to be innovative a little bit in your analysis and also in your visualization. Can you do something that, will not really confuse? Because sometimes I've seen some people present things and no one is actually understanding. I used to have one of the health economists in our team, and whenever he's presenting, he thinks really everyone is out of place. No one is speaking anything. He's too bright to make this in a very simplified manner. So you need to think of how to also be a little bit unique in how you present your findings, or what kind of techniques you explore. And then, of course, last but not least is about a call to action. And this comes to play whether it is in terms of advocacy. Some people work in advocacy. And in advocacy, really, our key message it's usually very, very clear that we need to know what is the key message that you're passing out. So whenever you're done with all your analysis and stuff, you really need to be very critical to put to the policymakers, what is it that you really want them to act? To the community members, what is it that you really want them to act? What is that change? Okay. To management, what is that? What is it that you really want management to act about? So it must be very clear. It must be very clear. Next slide. Okay. Yeah, I think that's the end of the slides. I would welcome any questions therein.
All right. Thank you so much, Andrew, for that presentation. I think I see Faith on the call now. So if Faith can speak, if you would like to add a few more pointers to what has just been presented before we then take questions from the audience, so that we also give you the opportunity. I know you had internet issues earlier on.
Hello, everybody.
Hi.
I'll begin by apologizing first of all. I've been having power issues, So the internet is on and off. I had to take the fastest means to a nearest restaurant. I'm really sorry about that. Secondly, this being my presentation, I think, good job, Andrew. You did it really well. I've looked at it from a listener point of view, and that was really good, really, really good. Thank you so much. And yes, just to still insist that data is it. Any moment you try analyze data from any point, then we are able to move forward in whatever point of life you're trying to reason from, specifically from the health sector. And just like there's a slide talking about analyzing digital health data, which is very essential, and that is to basically rabbit in that would barely exist without having analyzed any form of data that we received as healthcare practitioners, be it of people who are ailing from a particular disease. How can we prevent it? Again, we are still referring to data. And what medicine are we going to be giving? What works for this particular point of particular infection, what doesn't? At the end of the day, data is it. And from this end, I basically say that data is everything. And there's always a connection between monitoring and evaluation, that is M&E, and data. Since you collect data, you monitor data, and therefore you evaluate data for an end result. I think that has been it for me. Feeling like Andrew really exhausted it. So yeah, back to you.
All right, thank you so much for that great summary. So audience, if you have questions, now we have two speakers here on the call, two experts. So please feel free to ask questions around data, around digital health, around analyzing data. So please, you have the floor to ask questions. You can drop it on the chat, or you can also raise your hands and it would call you to your mute. So it can be either on any of the points that has been made today, especially around, how do you visualize your data? How do you present it? What are the types of data analysis techniques you can use for M&E? So if you have any questions around this, I think it would be the right time to ask either Andrew or Faith, and we'll be able to provide you with answers. Okay, so we're not seeing any questions from the audience, and I can't see any in the chat as well. So we take it that this has been well understood, and that you can now apply this to the case study. So I think there is a part of the case study where you also have to tell us how you are going to collect data for your case study and the kind of analysis you will do on it. So I hope this has provided a sort of guidance around that. Okay, so let us check YouTube. Please check YouTube if you have any questions there so that we're not missing out of.
There are no questions.
All right, thank you. So this seems like a well understood class. Thank you so much, everyone, for joining. We would come back here tomorrow by 10 a.m. same time to continue the last session for the workshop. So tomorrow morning is the last session on the workshop. Then in the evening tomorrow is where we'll have the case study presentation. So please come prepared to share what you've done so far. You can put it on the PowerPoint slide so that our experts can give you feedback. That's the advantage you have, to get feedback. But if you don't present and you just submit it like that, we might not be able to give everybody feedback on what they've done so far. So you can know what to do better and, what adjustments to make in your analysis. So come prepared to present. We'll call on a few people to present their case study so that Justus will be joining us. Other experts will also be joining us tomorrow. We have at least, I think, 5 experts will be on the call tomorrow evening. So please come with your case study prepared for presentation. so that you can get live feedback on them. I hope this is clear. So we'll see you tomorrow morning, 10 a.m., same time, same link. Look forward to the presentations that we've used throughout today in your email. So we'll send all of that to you. And tomorrow, after the last session in the evening, the case study submission link will go live so you can start submitting. And as I've said earlier, it closes on Wednesday. And once it's closed, we won't be able to open it again. And this is what qualifies you, as well as the pre-survey and post-survey, to get your certificate. Thank you so much. Do enjoy the rest of your evening. Bye.
All right, thank you.
Bye.
Yeah.